Hello. Hello to all Hello Black Men, Facebook family, and friends. For those of you that don't know me, I am Jackie McGrew. I am the sister of Jamie Jenkins. I am also a licensed clinical social worker and a certified mental health therapist. And so a couple of months ago, we talked about suicide awareness and prevention. Today, I would like to give a brief overview about ADHD, Attention Deficit Hyperactivity Disorder. And this is a good time to shed some awareness and to shed some light on this topic because our children are back in the full swing of school and they may be experiencing some issues. So let's just go ahead and get started. ADHD is a neurodevelopmental disorder that is defined by impairing levels of inattention and or hyperactivity and impulsivity. ADHD is associated with reduced school performance and academic achievements. So let's talk about the inattention symptoms. What that looks like is that a child may not be able to stay on task. They may be careless. They may avoid any kind of task that requires mental focus. And they may seemingly not care or listen to what's being said to them. And as far as the hyperactivity symptoms, a child is is having a lot of overactivity. They're fidgeting, they're unable to stay in their seats, they are excessively talking, they're blurting out answers over the other students. And so this is kind of some of those basic hyperactivity and impulsive symptoms that you want to monitor for. So I will include that about 5% of our children are diagnosed with ADHD and about 2.5% of adults are diagnosed with ADHD. And what ADHD looks like in adults is basically poor occupational functioning. So some of the causes of ADHD, there are a lot of them, but I'll just briefly say that it is associated with very low birth weight, and there is a genetic component, meaning that a first degree relative who has ADHD may pass that to their offspring or, parent or grandparent or something like that. So let's talk about some of the differential diagnoses, things that ADHD can can co-occur with, or some of the some of the disorders that looks like ADHD, and those are oppositional defiant disorder and intermittent explosive disorder. Some of those more severe behavior disorders. I also want to talk about the learning disorders that may occur with ADHD or may occur on their own as a separate disorder. And those are any type of intellectual disabilities or autism spectrum disorder. So you want to make sure that you are monitoring your child and observing your child and getting them tested if you're seeing anything that does not look normal. Also, some of the other disorders that can mask ADHD is anxiety, depression, and trauma. So depression can look like ADHD in that a child is unable to concentrate. So you want to be mindful of that. And trauma can show up as anxiety because a child may be acting out, especially if there is some type of physical abuse or physical child abuse or neglect. So I cannot emphasize it enough. Monitoring your child, observing your child, and getting them tested is imperative. And you want to coordinate with the school for any of these issues that you may see. So I'm going to close and sign off by saying stay tuned that Hello Black Man, Jamie and Kalisha and I will be doing a live and interactive discussion on this topic. And we'll say good night and remember that your mental health is just as important as your physical appearance and your physical health. Good night and blessings.